If you are sitting quietly or going about your day and suddenly feel your heart start to race, flutter, or pound in your chest without warning, it can be a frightening experience. In this video, we will explain a specific physical maneuver you can do immediately to help reset your heart's rhythm, along with 7 other techniques and habits to calm a racing heart quickly and safely. Please note, if your racing heart is accompanied by chest pain, shortness of breath, or feeling faint, you must seek emergency medical attention. However, for benign palpitations or sudden rapid heart rate, these natural tools are highly effective. The modified Valsalva maneuver. The primary action mentioned in the title is known as the Valsalva maneuver. This is a standard medical technique used by doctors and emergency personnel to stop a type of rapid heartbeat called SVT, but you can do a modified, gentle version of it safely at home. This acts like a mechanical reset button for your heart. Your heart rate is controlled by your body's electrical system. A major part of this system is the vagus nerve. You can think of the vagus nerve as the brake pedal for your heart. When you stimulate this nerve, it sends a signal to the heart to slow down. The Valsalva maneuver stimulates this nerve by changing the pressure in your chest. Here is exactly how to do it safely. Sit down in a comfortable chair. You want to be seated in case you feel slightly dizzy. Take a normal breath. Then pinch your nose closed with your fingers and close your mouth tight. Now, try to exhale gently against your closed airway. Imagine you are trying to blow up a balloon, but no air is letting out. Or imagine you are bearing down as if you were having a bowel movement. You should feel a pressure building in your chest and ears. Hold this pressure for about 10 to 15 seconds. Do not push so hard that your face turns purple. Just maintain a steady, firm pressure. After 15 seconds, release your nose and breathe out suddenly and forcefully. This release is key. When you bear down, you increase the pressure in your chest, which briefly reduces blood flow to the heart. When you let go, the pressure drops instantly and blood rushes back. This sudden change tricks your body into thinking your blood pressure has spiked. In response, the brain slams on the brakes. The vagus nerve fires instantly to lower the heart rate to compensate for the rush of blood. For many people, this instantly snaps the heart back into a normal, steady rhythm. This is a powerful physiological reflex. If it does not work the first time, you can wait for a minute or two, let your breathing return to normal, and try it one more time. It is a safe, non-invasive way to tell your body to take control of the rhythm. Most older adults can try this safely. Ice water face splash, the mammalian dive reflex. Here is another simple habit that uses your body's ancient instincts. There is a reflex built into all mammals, including humans, called the mammalian dive reflex. This is a survival mechanism. When a mammal dives into cold water, the body instantly knows it needs to conserve oxygen. To save oxygen, the brain immediately slows the heart rate. You can trigger this reflex without actually jumping into a pool. You simply need to convince your brain that you are underwater. The trigger for this is cold water hitting the sensory nerves on your face, specifically around the nose and eyes. This is simple to do at home. Fill a bowl or a sink with very cold water. Add ice cubes if you have them. The colder the water, the stronger the signal to the vagus nerve. Bend over and submerge your face in the water. Hold your breath and keep your face under for as long as is comfortable. Usually 15 to 30 seconds is enough. The combination of holding your breath and the shock of the cold on your skin sends a powerful message to the brainstem. The brain responds by slowing the heart. It is almost automatic. Even if your heart is racing due to anxiety or stress, this reflex overrides the stress signal. It is a hardwired physical response that you cannot mentally prevent. This brings immediate physical relief. If you cannot bend over a sink, you can achieve a similar effect by placing an ice pack or a cold, wet towel over your face. Make sure it covers your eyes and the bridge of your nose. Hold your breath for short intervals while the cold is applied. This is easier on the back and neck. This technique is particularly useful if the racing heart is caused by heat or emotional stress. It physically cools the body and forces a neurological reset. This fits into any routine. Cold water drink. Another helpful step involves cooling the nerve from the inside. If splashing your face is not practical, drinking ice-cold water can also be effective. The esophagus, the tube you swallow food through, runs right alongside the heart and the vagus nerve. They are neighbors in your chest. When you swallow a large gulp of ice-cold water, it cools the esophagus. This cold temperature can stimulate the vagus nerve physically as the water passes by the heart. This provides a double benefit. First, you get the vagus nerve stimulation. Second, you are hydrating the body. Dehydration is a very common cause of a racing heart, as we will discuss later. By drinking water, you fix the volume issue while calming the rhythm. This is simple to prepare. Take a glass of water with plenty of ice. Drink it steadily, but not so fast that you get a brain freeze. Feel the cold sensation moving down your chest. Focus on that cooling feeling. This sensory focus also helps distract your mind. Often when our heart starts racing, we panic. We think, oh no, something is wrong. This panic releases adrenaline, which makes the heart beat even faster. It becomes a vicious cycle. The cold water breaks that cycle. It gives you a physical sensation to focus on, and it physically interacts with the nerves controlling the heart. It is one of the safest and quickest first steps you can take. Most older adults can do this comfortably. The cough technique. One more easy change utilizes internal pressure. Similar to the Valsalva maneuver, coughing creates a spike in pressure inside your chest cavity. This is often used in hospital settings for patients who are conscious but experiencing a fluttery heart rhythm. It is called cough CPR in extreme cases, but here we use it gently. If you feel a flutter or a skipped beat that turns into a race, try coughing forcefully. It needs to be a deep, strong cough, not a shallow throat clearing. Use your diaphragm. Cough once, wait a second, and cough again. The mechanism is mechanical. The sudden increase in pressure squeezes the heart slightly and stimulates the vagus nerve. This can interrupt the electrical misfire. Think of it like a skipping CD or record. Sometimes a little bump is all it takes to get the needle back in the groove. The cough provides that internal bump to the heart's rhythm. This is easy to do anywhere. You can do this while sitting or lying down. It is important to feel stable, as a strong cough can sometimes make you feel slightly lightheaded for a second. This keeps you safe. Do not do this continuously for minutes on end. Just a few strong, purposeful coughs are usually enough to see if the rhythm will reset. If it does not work after a few tries, switch to a different technique like the breathing or cold water. This helps the body function more easily. Deep diaphragmatic breathing. Here is another simple habit that controls the nervous system. Often, a racing heart is a sign that your sympathetic nervous system is stuck in the on position. This is the fight or flight mode. To turn it off, we need to activate the parasympathetic system. Slow, controlled breathing is the remote control for this system. When you are stressed or your heart is racing, you tend to take short, shallow breaths into your upper chest. This actually tells the brain that you are in danger, keeping the heart rate high. You must force the breath down. Place one hand on your belly. Inhale slowly through your nose, trying to push your hand out with your stomach. Your chest should not move much. This is called belly breathing or diaphragmatic breathing. This pulls air deep into the lungs. Exhale slowly through pursed lips, as if you are blowing out a candle very gently. The exhale should be longer than the inhale. For example, breathe in for 4 seconds and breathe out for 6 or 8 seconds. The long exhale is the secret. When you inhale, your heart rate naturally speeds up slightly. When you exhale, it naturally slows down. By making your exhale longer, you spend more time in the slowing down phase of the cycle. This physically forces the heart rate to drop. Do this for at least 1 to 2 minutes. Close your eyes. Visualize your heart slowing down with every breath out. This mental visualization combined with the physical action is very potent. This works well for most older adults. This technique is the foundation of long-term control. If you practice this daily, you raise your threshold for stress. It takes more to make your heart race because your baseline is calmer. This supports overall health. Electrolyte balance, magnesium and potassium. Another helpful step focuses on the fuel for your heart's electrical system. Your heart is a muscle, but it is powered by electricity. This electricity is created by minerals moving in and out of your cells. These minerals are called electrolytes. The two most critical ones for heart rhythm are magnesium and potassium. If you are low on these, the electrical signal gets glitchy. Low magnesium is a very common cause of heart palpitations in seniors. Magnesium helps the heart muscle relax after it contracts. If you do not have enough, the heart gets irritable and twitchy, leading to extra beats or a racing sensation. Potassium regulates the heartbeat itself. Many blood pressure medications, diuretics, can flush potassium out of your body. If your levels drop too low, your heart becomes unstable. A racing heart can be a cry for minerals. If you feel your heart racing and you know you haven't eaten well lately, try consuming a potassium-rich food immediately. A banana is the classic example, but coconut water is even faster. Coconut water is nature's electrolyte drink. It is high in potassium and absorbs quickly. Drinking a glass of coconut water can help stabilize the electrical environment of the heart cells within minutes. This is a gentle, natural fix. Avocado is another excellent source. Eating half an avocado provides a heavy dose of both magnesium and potassium. This helps the body balance itself. You can also take a magnesium supplement if you have one, but food is generally safer and faster to absorb during an episode. A powdered magnesium drink mixed with water can be very calming. This fits into any routine. However, be careful with potassium supplements. Too much potassium is just as dangerous as too little. It is always safer to get it from food like bananas, potatoes, spinach, or coconut water, where the amounts are regulated by nature. This keeps you safe and healthy. Hydration check. One more easy change involves simple water volume. The heart is a pump. It pumps fluid, blood, through pipes, veins and arteries. If the fluid level drops, which happens when you are dehydrated, the blood becomes thicker and the total volume decreases. To maintain blood pressure with less fluid, the heart has to pump faster. This is a compensation mechanism. Your heart is racing because it is trying to make sure your brain gets enough blood. If you are dehydrated, your heart has to work double time. Seniors are at high risk for this. As we age, our sense of thirst diminishes. You can be significantly dehydrated without feeling thirsty. If your heart starts racing, ask yourself, when was the last time I drank water? If it has been hours, start drinking. Do not chug a gallon at once, as that can shock the stomach. Sip steady amounts of room temperature or cool water. Within 15 to 20 minutes, as the fluid enters your bloodstream, your heart won't have to pump as frantically. This relieves the burden on the pump. Check your urine color. If it is dark yellow, you are dehydrated. It should be pale straw color. Keeping your blood volume up is the simplest way to prevent tachycardia, rapid heart rate. This is easy to do at home. Avoid alcohol and sugary sodas when you are feeling palpitations. These are dehydrating and will make the problem worse. Stick to water or the electrolyte drinks we mentioned. This supports proper circulation. Identifying phantom stimulants. Here is a final simple habit regarding what you consume. Sometimes a racing heart is a reaction to a hidden stimulant. We all know coffee causes jitters, but caffeine and other stimulants hide in places seniors might not expect. Check your over-the-counter medications. Many cold and flu remedies contain decongestants like pseudoephedrine. This drug acts like adrenaline in the body. It constricts blood vessels and speeds up the heart. For a senior, even a standard dose can trigger a racing heart. This is a common trigger. Pain relief medications sometimes contain added caffeine to make them work faster. Read the label carefully. If it says for migraine or extra strength, check the ingredients for caffeine. Chocolate is another one. We love dark chocolate for health, as discussed in other tips, but it does contain theobromine, a compound similar to caffeine. If you eat a large amount in the evening, it might cause palpitations when you are trying to relax. Sensitivity increases with age. You might have been able to drink 3 cups of coffee in your 40s, but in your 60s and 70s, your liver processes stimulants more slowly. That morning, coffee might still be in your system in the afternoon. This requires adjustment. If you experience racing heart episodes frequently, try cutting out all caffeine and decongestants for 2 weeks. See if the episodes stop. Often, simply removing the chemical trigger is all that is needed. This keeps the body calm. Also, be aware of herbal supplements. Ginseng, bitter orange and hawthorn are often marketed for energy or heart health, but they can interfere with heart rhythm or medications. Always check your supplements. This ensures you stay safe. By using these physical maneuvers, the Valsalva, the cold water, the breathing, you have a toolkit to handle a racing heart in the moment. By managing your hydration and electrolytes, you build a body that is less likely to race in the first place. Most older adults can manage this comfortably. Remember, your heart responds to the signals you give it. Give it calming signals, give it the right fuel, and give it hydration, and it will serve you well. If you know someone over 50 who could benefit from this, share this video and subscribe for more simple health tips.